Welcome to the fourth in a series of 10 short videos called Schizophrenia Demystified. I'm Dr. Linda Snow-Griffin, a retired psychologist and the mother of a son with schizophrenia. This video is titled, What We Learned About Recovery. Let me start by saying that what we learned about the recovery process was based on my son Jacob's experiences. The truth is that not only can schizophrenic symptoms vary from one person to another, but the recovery process can also vary. Keep in mind that what may work well for one person may not be right for someone else. That being said, these are the key factors that have helped my son. Early intervention has been very important. As soon as we knew what was going on, we found a good psychiatrist to begin the process of finding the best medication for him. Recovery is greatly improved with early identification and treatment, and that is why there is such a push now for early interventions. Medication has also been very important for him. For Jacob, and for many, finding the right medication may take time and lots of trial and error. There are tests available now to narrow the search to find out what might work best, but we did not have that option 22 years ago. Even now, medication may work for a while, usually several years, and then must be changed because of side effects or decreased effectiveness. The good news is that newer medications continue to be discovered, and some have fewer side effects or can be more effective for his particular combination of symptoms. His willingness to try new medications has been very helpful. Psychological counseling is important. He has benefited from good psychological counseling as well. He has learned stress management techniques so that he can keep symptoms and relapses to a minimum. He has learned to take breaks from uncomfortable situations and learned to calm himself by listening to music. He has also found good community support. Both in school settings and work environments, he has been able to get accommodations thanks to the American with Disabilities Act. For instance, at school, he was able to take tests in a private room without any distractions. At work, he's been able to talk to customers on the phone by walking around his office. Walking and pacing help him focus and reduces the anxiety that he experiences when sitting for long periods of time. He also has been able to listen to music with earbuds when at school or at work. Initially, music helped reduce the impact of his voices. Now that he's no longer bothered by the voices, the music helps him to be more relaxed. Family involvement has been very important too. Research suggests that when families are part of the treatment team, recovery improves and relapses decrease. That is not to say that families attend every treatment session or interfere with patient confidentiality, but families can learn how to best help their loved one. In addition, they may be able to help them navigate the treatment world. Also, in my opinion, family involvement can send a message of caring and support. A good treatment team is a key. A good team involves shared decision-making. Jacob is an important part of the decision-making process. His team listens to his needs and does their best to find out what will work best for him. He has learned many ways to manage symptoms and live a normal, productive life. The symptoms can disappear from his daily experiences for long periods of time and remain in remission for months or even years until he encounters an extremely stressful event. Since he now has a good treatment team in place, he knows the early warning signs of a relapse and can address it with a psychiatrist or his therapist right away. Now he seldom has to miss work for issues related to his mental health. So these have been the key factors that have helped my son's recovery process. For more resources that we have found, check out my website at lindasnow-griffinphd.com or my book, Hope in Learning, Our Journey with Schizophrenia. If you have any questions, my contact information is also on the website. Thank you for watching this video, and please tune in to the next episode of Schizophrenia Demystified. The title of that video will be, Are People with Schizophrenia Violent?